Party, the Honorable Mwangi Nyaga, can proceed and lay the notice paper.
Thank you, Honorable Speaker. Honorable Speaker, I beg to table the following notice paper, which is running today, 17th to 18th of February, 2026, and today being a Tuesday, at 9:30 a.m., we have the following businesses. Honorable Speaker, we have the following papers, that is report of the Office of the County Attorney for the period of the 1st July 2024 to 30th June 2025, whereby I'm the sponsor of the said paper. We'll also be getting a letter on approval to replenish emergency fund as at 15 December 2025, myself being the sponsor. On statements, Honorable Speaker, we'll be getting a statement on status and management of the Beyond Zero initiative in Nyandarua County, which is being sought by Honorable Mirka Wajilo, MCA Creator Ward. Honorable Speaker, we'll also be getting a response to a statement sought by Honorable Patrick Mohende Kariuki on the status of employment and distribution of staff across the county, the respondent being Honorable Nyandarua Kingoli, Chairperson Committee on Public Service. On motions and bills, Honorable Speaker, we'll be getting a motion on the report by the Health Services Committee on Engineer County Level 4, annual report, and financial statement for the year ended 30th June 2024, and sponsor being Honorable Paul Geshawabaire, Chairperson, Committee on Health. We'll also be getting another motion, that is a motion on the report by the Committee on Trade, Industrialization, Cooperative Development and Partnership on Departmental Budget Implementation for the financial year 2023-2024, which will be sponsored by Samuel Kayani, Chairperson, Committee on Trade and Industrialization. Today at 2:30 p.m., Honorable Speaker, we shall be handling the following businesses. And one, we'll be having the following paper, that is report by Health Services Committee on Engineer County Level 4 Hospital Annual Report and Financial Statement for the year ended 30 June 2025, sponsor being Paul Geshawabaire, Chairperson, Health Services. On statement, Honorable Speaker, we'll be getting a response to a statement sought by Honorable Samuel Rimuye Kayani on status of gender equality among chief officers, and the respondent will be Honorable Nyandarua Kingoli, Chairperson, Committee on Public Service. On motions and bills, Honorable Speaker, we will be having a motion on report of the Committee on Public Works, Roads, Transport and Housing, and Energy on Nyandarua County Energy Plan 2024-2028, the sponsor being Honorable Simon Bogoboro, Chairperson Committee on Public Works, Roads and Energy. Tomorrow, Honorable Speaker, we will be having the following businesses, and in the morning hours, we shall have the following papers, that is report on by the Health Services on JM Kariuki Memorial County Referral Hospital Level 4 annual report and financial statements for the year ended 30 June 2025, and sponsor being Paul Geshawabaire, Chairperson, Committee on Health Services. We'll also be getting another report, that is report on the Committee on Budget and Appropriation on Nyandarua County Budget Review and Outlook paper, that is CPROP 2025, and the sponsor will be...
Maybe members for Kipipiri constituency, you can consult in Lawtons.
And The sponsor will be Honorable Isaac Kungu, Wajiro, Chairperson Committee on Budget and Appropriation. On motions and notices of motion, we'll be getting a notice of motion on the report of the Committee on Budget and Appropriation on Nyandarua County Budget Review and Outlook paper, that is CPROP 2025, which will be sponsored by Honorable Isaac Kungu Wajiro, Chairperson Committee on Budget. On statement, Honorable Speaker, we'll be getting a statement on status of RAD for the construction of Engineer Stadium and the works thereof, which has been sought by Honorable Jeffrey Wariru Kamwana, MCA Gadara Ward. On motions and bills, Honorable Speaker, tomorrow we'll be getting a motion on the report of this on the response to the statement sought by Catherine Nyawira Madenge on status of quality and safety. Together with the procedural motion, and the sponsor will be Honorable Isaac Kungu Wajiro, Chairperson Committee on Budget and Appropriation Committee. We'll also be getting another motion on report of statement sought by Honorable Naomi Gatia on status of youth programs, youth council, and youth service. And the respondent will be Honorable Joseph Kuria, through Chairperson Committee on Sports, Youth Empowerment, and Arts. Honorable Speaker, this notice paper is prepared and published pursuant to standing orders 40 and 41, and I hereby table the said notice paper.
Thank you, the Leader of the Majority Party. Member for Kaibaga, Honorable Mwangi Nyaga. The notice paper is duly tabled. Clerk, next order.
Order number 3, messages. Order number 4, petitions. Order number 5, papers. Mr. Speaker, sir, under this order, there are a number of papers to be laid in this House by the Honorable Elijah Mwangi Nyaga, the Leader of Majority Party.
Very well. Honorable Elijah Mwangi Nyaga, Leader of the Majority Party.
Thank you, Honorable Speaker. Honorable Speaker, I beg to table the two documents, that is report of the offices of the county attorney for the period of 1st July 2024 to 2025, and I'll also be tabling together with a letter on approval to replenish emergency fund as 15 December 2025, and I hereby table the said documents.
Thank you. The document is duly tabled, and I refer it to the Committee on Legal Affairs, Labor, Intergovernmental Relations, and Coordination. So, Chairperson, present, member of that committee. Yes, Honorable Matimo. Yes.
Mr. Speaker, sir, I'm not a member of the said committee.
Oh, I saw you on. Do you have a member of that committee? The Committee on Legal. Committee on Legal Affairs, Labor, Intergovernmental Relation, and Coordination. Sorry? Yes, Honorable Lucy Kidinji. Yes, it's let me take you back. It's a report of the Office of the County Attorney for the period of 1st July 2024 to 30th June 2025. I have referred, the document has been tabled, and I have referred the same to the Committee on Legal Affairs, Labor, Intergovernmental Relation, and Coordination. So I was seeking how much time you may hold brief for your chair that you need to respond.
Thank you, Mr. Speaker. I feel 60 days will be enough.
60 days you can report to your chair and the committee. Then
Yes,
the clerk ensure that the same is brought back to the House within that duration. Then we have a letter on approval to replenish emergency fund as at 15 December 2025. The document has been duly tabled, and I refer it to the Committee on Special Funds, Accounts Committee. That is led by Honorable Dhinji, who is a member of that committee. Special Funds. Yes, Honorable Daniel Gitau.
Mr. Speaker, I am not that committee.
Okay. Yes, we have anybody from the Committee of Special Funds? I'll give direction in regard to that. Yes, Whip. Yes, Honorable Deputy Speaker, you are a member of Special Funds? Yes, Honorable DS is a very senior member of this House, so he take the... Honorable DS is the document, the committee on, is the letter of approval to replenish emergency fund as at 15 December 2025. It has been tabled by the majority leader, and I have referred it to the Committee on Special Funds account. So I was seeking how much time your committee need to respond back to the House.
Honorable Speaker, you may give us 30 days.
Thank you. You may report that to your chair and committee.
Mr. Speaker, sir.
Yes, let me first give direction in regard to that, then I come to you, Honorable Matimo. So clerk, ensure that within 30 days, the document is brought back to the House. So, Honorable Matimo.
Mr. Speaker, sir, it was generally the same as they bring the report. I would humbly request that part of the report as they table, let them tell this Honorable House how the previous monies has been spent. The money that we did approve for the emergency fund, let them include it in the report. Thank you, Mr. Speaker.
Well noted. But I wonder how that is supposed to be. But I'll give direction in regard to that. I thought it's supposed to be brought as a motion or something like that. But we will. Kawanjiro Ndirango. The only elected woman in Nyandarua.
Thank you, Mr. Speaker. And I stand here this morning to seek a statement from the Chairperson Committee on Health. And just a background on this statement, Mr. Speaker. Over the holidays, over the recess period, we had time to interact with our people, and we got to get into the interiors of our wards, Mr. Speaker. And we realized that despite us having the health centers at the center of the ward, there are people who cannot access those health centers, one, because probably of lack of finances, and two, because they are sickly, and others are old and they do not have people to send to the health centers to seek for medication. And when we were having that discussion, someone came with a proposal that we get mobile clinics that can be going to the interior part. Probably one day they go to Karagoine, the other day they go to Gedogosho, so that those people who cannot access the health centers because of the distances can then come there with those mobile clinics, and they can get their medication from there, they can get their pressures from there. And that provoked me to think about the Beyond Zero clinic that was operational, and we are not sure whether it is operational or not. So this statement is about that. And once we get the report or the answers from this statement, Mr. Speaker, then as an assembly we can decide the next course of action. Because I know even members like Honorable Mwangi Gishoki would want to see a mobile clinic going around his ward maybe 2-3 days in a week, so that the medical services can get closer to those people who may not be able to go to the health clinics, or may not have even that 50 bob or 100 shillings to use a boda to get to the health centers. So, Mr. Speaker, that is why I am seeking this statement, and I see my good friend Honorable Mangesha is in the House, the chair of the committee. I'll indulge on him that this touches the lives of our people. if you could get the least time possible to respond to the statement, then we can decide as an assembly the next course of action so that we can help our people. Having said that, Mr. Speaker, now I want to seek the statement. Mr. Speaker, sir, I seek a statement from the chairperson of the Committee on Health Services on the implementation and current status of the Beyond Zero initiative in Nyandarua County. Aware that Article 43(1) of the Constitution of Kenya guarantees every person the right to the highest attainable standard of health services, further aware that Part 2 of the 4th schedule to the Constitution that the county governments are responsible for the provision of health services, including management of county health facilities, ambulance services, and the promotion of primary health care. Noting that the Beyond Zero initiative was launched in the year 2014 by then the First Lady, Her Excellency Margaret Kenyatta, as a national flagship program aimed at reducing mortality rate and during childbirth by improving access to essential health services, particularly in remote and unserved areas. Acknowledging that the program introduced fully equipped mobile clinics intended to bring antenatal care, immunization services, HIV testing and treatment, laboratory services, and other basic outpatient services closer to vulnerable populations. And Mr. Speaker, further acknowledging that the initiative was implemented through collaboration between the national government, the county government, development partners, and the private sector, and that several of the mobile clinics were subsequently handed over to the county government for integration into their respective county health services. Concerned that in Nyandarua County, Beyond Zero mobile clinics were deployed to support the delivery of maternity and child health services, yet there is limited publicity publicly available information regarding their present operation status. Further concerned that it is not clear which authority is currently responsible for the management or deployment of the Beyond Zero mobile clinics in Nyandarua County, whether the said clinics are fully integrated into the County Department of Health Services, and whether the program remains active following the conclusion of the tenure of the former First Lady, under whose leadership the initiative was established. Taking note that from such flagship public health interventions to achieve long-term impact, they must be properly absorbed into existing health services, adequately funded, and well-staffed and subjected to clear accountability frameworks. Are managed under the Nyandarua County Department of Health Services, the National Ministry of Health, or any other administrative arrangement. Number 3, details of staffing, funding, maintenance, and day-to-day operational responsibility of the mobile clinics. Number 4, confirmation of whether the Beyond Zero initiative is still operational in Nyandarua County, and if so, the scale and frequency of its activities, including number of patients attended to in the last financial year across the county. And finally, clarification on whether the Beyond Zero mobile clinics can be used for services, including delivering medication to people in the village in close schedules, and it is important we know the operation schedules, and it is important we know the operation of this mobile clinic. Therefore, Mr. Speaker, I seek the statement. Thank you.
Thank you, Honorable Milka Ndirango. The statement is duly sought, and I committed to the chairperson on Committee on Health Services, that is Honorable Paul Ngesho Mbaire, member for Kipipiri. Maybe you can tell us how many days you need to respond back to the House Chair.
Thank you, Mr. Speaker. Mr. Speaker, that statement we can respond within 28 days.
Thank you. Clerk, ensure the said business will come up within 28 days in regard to that response. Next order.
Under the same order, Mr. Speaker, sir, there is a statement response to be issued by the Honorable Edinald Wambugu Kingori, the Chairperson, Committee on Public Service Administration and Devolution.
Very well. And Honorable Edinald Kingori. Yes, Honorable Peter Gadungo is usually your neighbor always. Maybe I know you have the brief.
Thank you, Honorable Speaker. Honorable Speaker, I'm holding brief for the chairman on the Committee on Public Service Administration and Devolution on the status of the number of employees in the county public service in the executive. Honorable Speaker, if you remember, Honorable Kingori is the one who did outthrow me from the position of the majority leader. But we are blessed to be back in this assembly, and we serve in the same committee, and I want to hold brief of him, Honorable Speaker, as a member of that committee. And Honorable Speaker, I wish to sincerely thank the office of the Speaker and the clerk of the county assembly for the invariable logistical support throughout the course of this exercise. I also extend my heartfelt appreciation to the members of the committee for the unwavering commitment, active participation, and variable contributions in the preparation of this report. The committee further acknowledges the dedication support provided by the
order,
staff
Mr. Speaker.
of the county assembly.
Yes, Honorable Kongo.
Honorable Speaker, I want the mover to confirm whether we have the report, because I'm trying to look at it in our gadget. I can't see it.
Very well.
I want to follow up on that report.
ICT kindly confirm every member has got the report in their system. So other members, can you view the report from your gadgets? There's no network. Just let me see what ICT will do about it. Maybe minority vote could have facilitated the loss of network. Yet the Wi-Fi is fully subscribed.
The electricity, when it is switched off, it affected the routers, and they are now working on the routers.
Okay. Once you retire from representing the people of engineer, I think you should also apply for an ICT directorship. You seem to be doing very well. So maybe, Honorable Kongo, what do you think? Do you think he should be reading as they are restoring? Because it's a 4-page, so that you can be noting. Yes, maybe he can be proceeding as ICT are working on it. So you can proceed, Honorable Katongo.
Thank you, Honorable Speaker. And Honorable Speaker, it is very hard to employ a politician in an office. So I don't think Honorable Gishoki will qualify anywhere. He needs to be appointed in any political office. Thank you, Honorable Speaker. And Honorable Speaker, as I was saying, I also extend my heartfelt appreciation to the members of the committee for their unwavering commitment, active participation, and valuable contribution in the preparation of this report. The committee further acknowledges the dedication support provided by the staff of the County Assembly, whose efforts greatly facilitated the successful completion of this report. We are equally grateful to the department for its cooperation and availing the necessary information that informed our deliberations. Mr. Speaker, sir, on behalf of the Committee on Public Service, Administration and Devolution, it is both an honor and privilege to present this response to the Honorable House. Honorable Speaker, and Honorable Speaker, the Committee on Public Service Administration and Devolution comprises of the following members, Honorable Speaker. That is Honorable Edinard Wambugu Kingori as the chairperson. We have Honorable Sarah Sacha Ngema Wamai as the vice chair, Honorable Kiro Gashomba, Honorable Gadungu Kamau, Honorable Zakari Mwangi, Honorable Kuria Duo, Honorable Wajiko Kabiru aka Maria Harun, Honorable Catherine Nyawira, and Honorable Muhende Karaoke as members. Honorable Speaker, we have our secretariat and read by the committee clerk, that is David Mutahi. Honorable Speaker, on the committee mandate, I will not dwell on that, Honorable Speaker. And Honorable Speaker, there are terms of reference that the statement was sought read as follows. I hereby seek a statement from the Chairperson Committee on Public Service Administration and Devolution addressing the following concerns. Honorable Speaker, aware that Article 232 of the Constitution of Kenya 2010 outlines the values and principles of public service, which in turn here include accountability for administrative acts and transparency, and provisions to the public of timely and accurate information. Further, we are, Honorable Speaker, that the primary functions of the CPSB is to recruit and appoint county government employees, promote and discipline them, and perform any other functions related to human resource management within the county government. Noting that the human resource sector in the county has been facing myriads of challenges, key among them the human resource gaps in some departments and over employment in other departments, which has allegedly created a crisis on both recruitment and the rise of the county wage bill, Honorable Speaker. Further noting that the CPSB has a duty and a responsibility under Section 59, 68A, 68B, 68C, 68D, and 68E to ensure the values and principles of the public service are adhered with, and that the county has representation of the marginalized persons living with disability, gender, ethnicity, while ensuring equity and fair distribution. Honorable Speaker, concerned that the County Assembly has not been made aware of the analysis of above, which the county government continues to experience unprecedented rise in wage bill with allegations of poor service delivery despite the huge workforce. Arising from the foregoing, I seek the chairperson of the Committee on Public Service Administration and Devolution does expedite the consideration of the annual report of the CPSB and report to the House in compliance with provisions of Section 59(2), 3, 4, and 5, and 6, 68A, 68B, 68C, 68D, 68E. Provide a detailed report on the distribution of staff across the Nyandarua County Public Service Board, including names, designation, and duty stations as follows. The number of employees in every department and all the chief officer and has distribution in the 25 wards, the number of employees in every board under the county government of Nyandarua, and the distribution in the 25 wards, the number of contract staffs and long-serving casual workers in each department or entity, and distribution in the 25 wards. Honorable Speaker, the Committee on Public Service Administration and Devolution undertook the responsibility of addressing concerns raised by Honorable Karaoke Muhende, the members of County Assembly for Magumu Ward, that is the specially elected member, regarding the status of employees in the county public service under the county executive. These concerns were formally brought before the Honorable House, and pursuant to your directive, the committee was mandated to investigate the matter and submit a comprehensive report for the Assembly consideration. Mr. Speaker, sir, in line with your directive, the committee held several sittings to deliberate on the issues raised. It was anonymously agreed that additional information and clarification were necessary to adequately address the concerns outlined in the statement. As a result, the committee formally wrote to the Department of Public Service Administration and Devolution requesting the required information through a letter dated 25th April 2025, referenced NCA/CRAC/Public Service and DD 27/25. Mr. Speaker, in response, the CCM for department submitted a letter referenced Nyandarua/PS AD and D/administration/2 volume 110, which was received by the office of the clerk on the 30th April 2025. While this response addressed some of the committee's concerns, several issues remained, and so subsequently, Mr. Speaker, sir, the committee invited the department for a consultative meeting to further deliberate on the outstanding matter. Following this engagement, the committee issued an additional request for the information through a letter referenced NCA/CRAC/10 PSAD 28/25 dated 5th June 2025. In the response, the department, through the office of the clerk, submitted a letter referenced Nyandarua PSAD AD 2 volume 1 dated 18th June 2025. Honorable Speaker, on chapter 2, that is the committee's observation and findings, the payroll summary and observations as at March 2025, Mr. Speaker, sir, the committee made the following observation from the information submitted by the county executive member for the department by director, Reverend Nyandarua PS AD&D admin 2 volume 110, and the summary of the total employees on payroll as at March 25, 2025 is as follows, Honorable Speaker, and we have categorized, they are in categories. There is the category of local contract, there is the category of permanent, and the number of total employees. And on local contract, Honorable Speaker, we have 680 employees. On permanent and pensionable, Honorable Speaker, we have a total number of 22,030, and the total employees in the county, Honorable Speaker, we have a total number of 2,710 employees. And Honorable Speaker, I wish the honorable members have already got the document in their iPads, Honorable Speaker, so that they can look at the table, because we can't be able to go one by one. It will take a lot of time, but if it is not still available, I will read out, Honorable Speaker, as you confirm, or as you confirm to me whether it has displayed in the tablets, Honorable Speaker.
So members, I'm reliably informed the networks is okay, so you can now access the document from your tab.
So, Honorable Speaker, there is the Department of Agriculture, Livestock, Fisheries and Irrigation. As members can check the local contract, we have three employees. We have 177 permanent employees, so a total of 177. In the CPSB, we just have 7 in local contract, 9 permanent, 16 in total. In education, technical training, culture, gender and social protection, we have 527 who are in local contract, mostly CDE teachers, and we have 341, giving a total of 868 in the Department of Education. In finance, economic planning, ICT and revenue, we have a total of 35 in local contract, 212 in permanent basis, and 247 the total. In the governance department, Honorable Speaker, that is the chief of the staff, the county secretary and county attorney, we have 48 in local contract, 89 on permanent basis, and 137 in total. Health services, this is where we have 36 local contract, 813 in permanent and pensionable basis, 849 in total. Roads and physical planning, housing and urban development, we just have 3 in local contract, 31 in permanent and pensionable basis, 34 in total. We have a Rokarau Municipal Board with 1 in local contract, 5 permanent and pensionable, a total of 6. Municipal Board of Engineer, we have 2 local contract, 4 permanent and 6 in total. Mairunya Municipal Board, we have 1 in local contract, 3 in permanent, 3 permanent and pensionable, 4 in total. Public Service and Administration and Evolution, 5 in local contract, 152 permanent and pensionable, 157 in total. In Road Transport and Energy, we have 4 in local contract, 103 in permanent and pensionable basis, 107 in total. Trade industrialization, cooperatives, development and partnership, 3 in local contract, 26 in permanent and pensionable basis, 29 in total. In the water department, that is water sanitation, environment and national resources, and climate change. Local contract we have 4, permanent and pensionable is 45, 49 in total. And Honorable Speaker, Rastri, that is the Youth Affairs, Sports and Innovation, we just have 1 in local contract, 23 on permanent and pensionable basis, and 24 the total number. Honorable Speaker, that is what gives you the total of 680 in local contract, 2,030 on permanent and pensionable basis, and the total number of employees in Nyandarua County is 2,710. Honorable Speaker, we have additional employees not on March 2025 payroll, that is newly employed in health services, that is 30, and we have internship interns, that is 170. Honorable Speaker, in future payrolls, if they get included, the payroll will rise up to 2,910. Honorable Speaker, the largest department by workforce is the Education, Technical, Training, Culture, Gender and Social Protection, where we have a total of 836 employees, which translates to 32% of the total workforce, and closely followed by health services with 849 employees, that is 31% of the entire workforce in the county. The department with high local contract proportions is education, which has employed 527 local contract staff, which is 77% of its workforce. The governance has a high number of those in local contract employees compared to permanent ones, which is 48 of local contract employees compared to permanent and pensionable 89. The smallest entities, Honorable Speaker, is the municipal boards, that is Orokarao, Engineer and Maironya collectively, employees 16, staff, mostly permanent. Youth Affairs, Sports Innovation has the smallest full department, workforce of just 24 staff, Honorable Speaker. Understaffed or low-staffed departments is RAD, Physical Planning, Housing and Urban Development with just 34 staff, Trade and Industrialization with just 29 staff. This might require staff capacity review depending on operational needs. Pending additions, Honorable Speaker, is the 30 newly employed staff in health services, suggests ongoing expansion in that department. 170 interns represent a significant upcoming temporary workforce. Their distribution across department is not provided, but it is important for workload planning. The payroll balance, Honorable Speaker. Mr. Speaker, sir, based on the information provided, it is evident that permanent staff constitutes 75% of the payroll, accounting for 2030, or that is 2030, out of the 2,710 employees, while those on local contracts make up to the remaining 25%, Honorable Speaker. Honorable Speaker, further information is that the additional information submitted by Director Reference NYA/PSAD/Admin 2, Volume 1, 11, dated 18th June 2025, along with details provided during the consultative meeting between the department and the committee, was as follows. Following a lengthy deliberation with the department, the committee received the following updates. There is human resource challenges in agricultural sector. The Department of Agriculture, Livestock, Fisheries and Irrigation is facing severe staffing shortages due to numerous retirements without replacements, Honorable Speaker. A total of employees in these departments are expected to retire between January and December 2025. That is a total of 69 employees, Honorable Speaker. the county boards on payroll. Currently, only 4 boards on the county payroll. That is Maironya, Ijinia, or Karao municipality boards, and the Nyandarua County Public Service Board. Other boards include Orwasco, Nyadawasco, and County Investment Boards are not on the county payroll. The staff establishment and performance management, Mr. Speaker, the department is in the process of developing a comprehensive staff establishment plan. A new Directorate of Performance Management has been established, currently staffed by only 2 officers and now operating at a very limited budgetary allocation, Honorable Speaker. The staff appraisals are scheduled to begin at the ward level. Performance appraisal for many directors is planned for May and June 2025. Honorable Speaker, sub-county administrators will play a key role in validating staff participation in the appraisal process. Only those who fill the appraisal forms will be considered active staffs, Honorable Speaker. Honorable Speaker, employment and workforce management. Employment gaps identified by the department are forwarded to the cabinet for approval rather than directly to the CPSB. Each county department has 3 designed champion officers responsible for monitoring work progress. The department reported critical gaps requiring Kenya shillings 200 million in funding. However, this proposal was put on hold due to financial constraints by the cabinet. The county currently employs 680 contract staff. Mr. Speaker, sir, the committee further requested the department to submit the following data promptly: the number of employees in every board under the county government of Nyandarua, distribution in the 25 wards, the number of contract staffs and long-serving casual workers in each department or entity, and distribution in the 25 wards. Honorable Speaker, in response to question 2.1, the department informed the committee that where efforts have been made to compare data on the distribution of staff across the 25 wards, the information currently available is not comprehensive. The department is in the process of conducting a detailed staff distribution and deployment exercise aimed at capturing complete and accurate data across all staff cadres. Once this exercise is concluded, the updated information will be uploaded in the Human Resource Information System, that is HRIS, and subsequently shared with the committee. Therefore, Mr. Speaker, sir, the department requested the committee to allow it time to finalize on the ongoing exercise, after which a full and comprehensive report will be submitted for the to the committee for consideration. Mr. Speaker, in response to question 2 regarding the number of contract staff and long-serving casual workers in each department or entity, as well as their distribution across the 25 wards, the department submitted a list detailing all casual workers. The list includes individual staff information, their respective departments, and ward placements. Therefore, please refer to the annexures for the full details. After thoroughly reviewing the submissions from the Department of Public Service, Administration and Devolution, and engaging in extensive consultation, the committee concludes that the CPS, that is the County Public Service, currently comprises 2,710 employees, that is 75%, who are on permanent and pensionable basis, and 25% on local contract, with a potential increase to 2,910 upon onboarding the 13 new health committee, the health workers, and 170 interns. However, a complete and accurate staff distribution across the 25 wards is still pending, as the department continues a detailed verification and deployment exercise. The committee notes significant staffing challenges in departments like agriculture due to upcoming retirements, and staffing in other such as roads and trade, where a list of contract and casual workers was provided. More structured data is needed for informed decisions making. Only 4 boards are on the county payroll, while others such as Orwasco and Nyandarua remain outside this framework. The newly established Directorate on Performance Management is a step forward, though it faces capacity and funding limitations. Notably, a proposal requiring Kenya shillings 200 million to address the staffing needs was deferred due to budget constraints. The committee urges the department to fast track the completion of the ongoing HR exercise and submit the outstanding data, as this will be vital for strategic workforce planning, equitable resource allocation, and improved service delivery. Mr. Speaker, on addition to this report, I would like to add that we didn't have a functional county public service board. Unfortunately enough, this house has been able to pass the names of those who are in the county public service board. The governor has appointed them. I get to understand they have already been oriented. And Honorable Speaker, I would say the honeymoon for the county public service board is over. They should now engage. I can see Honorable Geshe here looking at me, and what he would like to see is that the staffing gaps in the Department of Health gets addressed. We also have issues in the Agriculture Department. By the end of 2025 December, and we are in February of 2026. This means already those who had been earmarked to retire, because retirement, you can't defer retirement. They were of age which is 60 years and 65 years for those people who are differently abled. So they retired. So we can't take chances. And Honorable Speaker, as a house, we need to get answers from the executive on when these very vital recruitments will be going on, Honorable Speaker. And as it has been said, with the new county public service board in place, because there has been talks of ghost workers and everything, it should be their first task to ensure that whomever is being, the workers who are not fully utilized, we make full utilization of them, considering the huge bills that we are having in form of salary payments, that is the wage bills, Honorable Speaker, which consumes almost half of our budget. Honorable Speaker, we should make good use of this money to give services to our people. And with that, Honorable Speaker, thank you very much. And I can't see the seeker of the motion. Maybe you would have responded. Honorable Speaker.
Thank you, Honorable Gatongo. Yes, Honorable Kongo.
Thank you, Honorable Speaker. I have interest on this statement, though it was sought by Honorable Muhende, who is not present, but it is of utmost importance. And the one thing I want to note from the very onset, Honorable Speaker, I'm very disappointed, very much disappointed, because this was a statement that was sought in March last year. We are almost a whole year, and this is the kind of response that we are getting. Sometimes it disappoints me too much, and I don't even understand where the problem is, whether it is us or whether it is the executive. This is a statement that comprises an issue that takes 40% of our revenue. We are talking of 2.9 billion every year that goes to the compensation of employees. 40% of our revenue. And that is why I have interest, because we have been trying to seek information on payroll to no avail. Honorable Speaker, Honorable Mohede requested candidly that he wants to see staff establishment per ward. And in the report, according to the executive, they say they don't have information. How would I even believe what Honorable Gathoko has read and given numbers? Who are these people? If the executive don't know where they come from. They have given a report per department. but they don't have details of these people per department, who they are and where they come from. Who do they pay, Honorable Speaker? Every month they pay. Who do they pay, Honorable Speaker? It is very serious, Honorable Speaker, such that when Honorable Gadogo tells us that there was no functional board, the board existed up to September. And the statement was sought in March. What does that say, or what does that tell us? Honorable Speaker, as we are speaking today, we have a deficit in our budget for compensation of employee to a tune of 220 million, and you will be seeing it, Honorable Speaker, when the supplementary budget comes in. Being asked, this House being asked to increase the compensation to employees, yet we don't know who these people are. Honorable Speaker, we have said again and again that we want staff establishment, a report on staff establishment on this county. If you read this report, it is telling us that 69 staff in agriculture department were supposed to be retiring in December. So it means they retired. Do we have a replacement policy? What is happening with the work that they were doing, because currently they are not there? Those offices are vacant. And what happens to the budget that this House provided for a whole year for those staff? Who is doing the reconciliation? Honorable Speaker, the greatest problem in this county is here. There will be no service delivery if our employees and our staff are not accountable, and nobody is accountable. Because we are expecting, we've had County Public Service Board, we've had the Department of Public Service, we've had the County Secretary. And all those departments are supposed to be resonating the issue of staff in this county. But they cannot tell us. We have had biometric for 2 times. When Honorable Kimemia, the second governor, came, there was a biometric check. We want to know the number of employees. No report was given. When this governor came in, there was another one. No report was given. Every year, we come here requesting for budget, but we cannot be able to account these people where they are. Honorable Speaker, you realize that after the retirement of the 69 agriculture staff, they are going to employ people in health. What happens? Today, if you go to a Johi market, we had 2 staff who are supposed to be cleaning the market. They retired 4 years ago. There was no replacement. For 4 years, we have remained without those staff. There was a budget. So we ask ourselves, what happened? I would request really, Honorable Speaker, I don't know whether it is through this committee again. Me, I would request that we treat this response as an interim report. We need to fight this matter more comprehensively so that we can be able to establish staffing per department. Let us know if it is agriculture, how many are they, what are their job group, and where do they come from, and what are the competence gaps in that department. By so doing, we will be able to know whether we have value for money, for the amount of money that we are giving every year. Otherwise, there will be no service. I can assure you, Honorable Speaker, that there are people in this county that they are paid salaries every month, but they never report to duty. They never report to any work station. But we continually pay them, and we also have very serious gaps of competencies that we don't have in this county for the people who can be able to deliver services to our people. We have a big problem, Honorable Speaker. And I don't know, because when we sought, or when Mohede sought this statement, we thought that we are going to get information. One, and the other thing you are going to note, there are some areas that have seriously been marginalized when it comes to employment in this county. And we know, and I think it is of interest to every member to know, do we have even regional balance when it comes to employment of our staff? Do we need to do evaluation, job evaluation for our people? Because I think any government should be very serious on service delivery. We need to do evaluation, job evaluation, and ask ourselves, out of the 2,700 employees we have employed in this county, what value do they bring to this county? Where we need, today I know of a situation, I can tell of people who are working in, who are If you look at their education or their career, they are in wrong departments. All we need is to redeploy them. You realize somebody is working, for example, is working in agriculture and they are supposed to be in trade. Because by the time the advertisements were made, instead of looking for the competencies, we were looking at who and who we wanted to employ, instead of looking at the gaps and the competencies that we have in this county. I am proposing, and I know maybe the committee may not take this, but I am proposing that we need to dodge on this matter further, Honorable Speaker. Otherwise, it will be a very great disservice to the people of Nyandarua. If we come here, close our eyes, think that everything is okay, and expect that there will be service delivery in this county when we have not resolved the issue of staff establishment, when we have not resolved the issue of replacement policy, when we have not done job evaluation to see the gaps that we have in our competences in our workforce, and then ask ourselves, how do we deal with the issue of bloating wage bill? Because if it continues this way, sooner than later, we will not be able to do any development because all the money will be going to the compensation of employees. Because we have not been able to evaluate our job, and then we redeploy where we feel that people need to be redeployed. So I'm not satisfied with this report, and maybe I will consult. We need to move a motion. Maybe the statement might not take the weight that it deserves, but I think we will consult with the clerk's office, and the committee need to move a motion to drive this matter further so that we can be able to push the executive to do what is necessary and to help this county to receive the services that they deserve, because we pay too much, 40% of our revenue every year. Thank you, Honorable Speaker.
Honorable Geche, member for Kipipiri, proceed.
Thank you, Mr. Speaker. Mr. Speaker, mine is to raise the issue of replacement. You have heard that people are retiring. May it be either natural attrition and they are not replaced. And this one, when you look at the wage bill, it is not changing. Like now, take an example of the 69 from agriculture. The budget was there, it was provided, and they are not hiring. Year 1, year 2, year 3, but no issue of budget, either budget cut toward the wage bill. Let me cite an example with the health committee, the health department. It has been rated to be the second in terms of human resource, with the 31%. It is closely following the education committee. You see, that report itself, it is erroneous. Because from where I sit, I know in the health department then it means there are unaccounted humans, unnamed then. Because at a contract, because most of the cashews, including the cashews, they are under contract. JM itself, JM alone, it will have over 300 cashews. But when you come to this report, and you are told that, you see, this is the number, you fail to understand where this data, this credible data is, where has it been gotten from? And Mr. Speaker, this is as the chair budget had indicated, is that it is an eye opener, because if we cannot be able to account for the human resource that we are having in the entire county, even now to manage the wage bill, it will be hard. we will only be realizing a ballooning wage bill. And also, Mr. Speaker, when it comes to human resource, this is an emotive, it is an emotive debate. And maybe time is not on our side, because we have less than 1 year, 7 months. But it can only be better if we talk of staff establishment for the department. We need to familiarize ourselves with this particular employee reports to who, when, how. And we must have a very good human resource management in the county government, because the labor, we talk of human resource are a key, are a vital and crucial asset of any organization. If we cannot be able to account as a county, then we need to have a structure, to have establishment that will help us and will guide our county to posterity. Mr. Speaker, when you look at the Office of County Secretary, it's office of the County Public Service Board. They need to sit down. They need to chart the way for this county, because it seems that there is a conflicting role that within this, the Office of the County Secretary and that of County Public Service Board, there is conflicting role. I had some time back forward with the Department of Health. You find a staff has lost his or her life, and you ask the department, how long will you take to replace this particular person? And the procedure there, they will tell you or inform you that we write to the County Public Service through the Office of the County Secretary. When you forward to the Office of the County Secretary now will give some excuses that you see, we cannot, okay, the bureaucracy here, Mr. Speaker, is the County Secretary, when you follow with him, he will tell you that this matter has not been brought before me. And when you confront him with the fact, what happens is the department will suffer because of making these disclosures. And mostly the department now, they are owning that it is we who have not wrote. And when you guide the department to be writing to the County Public Service Board, now, so the problem could be somewhere, even in terms of replacement, the Office of the County Secretary. And has it been indicated, there will be several motions that will be drawn from this statement. And for me, I will draw that motion on replacement. I will try to follow, because to effectively and efficiently manage the human resource in this county, we need first to maintain those whom we have. The budget that there is in there, we replace through the natural attrition or any other means, we replace. Because it also beats the logic, Mr. Speaker. I have found in some other news that the county government of Nyandarua, there are several employees who have sued the county government. And they are eagerly waiting for compensation. So other fronts have been opened. The already accounted employee here will also earn or get compensation and money. That particular employee has not been replaced. He or she is there awaiting compensation. The compensation is awarded when you violate the labor rules and the employees' rights. So, Mr. Speaker, this is a debate that we need to deeply reflect about it so that we can harmonize and come up with a elaborate plan that this is the number, this is our people. Though it has taken a century to get this report, it's a good report and we can cultivate more. Thank you, Mr. Speaker.
Honorable Mbae, member for Githioro.
Thank you, Honorable Speaker, for this opportunity. I will only give my retro thinking about the report that we have received. One is to recommend the work that has been done by the committee, and also the recommendation that they have brought forward to this House. It is very unfortunate that, Honorable Speaker, in this county we are calling ourselves that we have a slogan that we feed the nation. And as we feed the nation, we don't have enough staff in the Department of Agriculture. We should need to get the value of what we are allocating for the department. At the same time, what we are, our slogan must have, what it deserves. Cannot feed the nation when even the department have a deficit of deficit of workers. If you go today in our sub-counties, it is good to let the House know that even one officer is in charge of almost the whole PPL constituency, because those who are there before, they have retired, and for sure members of public are suffering for not having an agricultural officer who they can consult when they need information on matters to do with agriculture. Honorable Speaker, sometimes back there was a head counting on the Department of Environment. They were doing the head counting on the members of staff who are supposed to be doing the cleaning work within our centers. And with the information that I received, I don't want to say that it is 100% information. Some of the information that I was getting from members there is that there are so many members who are employed to be the cleaners in our centers. Some of them, they have never shown up even on the field, and yet they are receiving salaries. It is very unfortunate that we have other members who are employed to be working as the cleaners in the towns, yet they changed their work to the revenue. They started collecting revenue, yet the person was employed to ensure the town is clean. You find that we are getting people who are working in the department that were not even employed to work in those departments. One of the reasons why we are not even getting much value in this county, it is because we employ a certain person with qualification to work in a certain department. After that, the person is removed and taken to a department that even he don't understand that kind of work. Honorable Speaker, it is the high time that we need not to rent on this matter here. I don't understand how even you yourself as a member, you have a livestock in your place, in your home, and you cannot be able to identify them even with their ages and where you bought them. How it's so hard that the Department of Health cannot be able to account, to get the right number of the people who are employed and where they come from. We must push very hard to know even every ward, how many employees they are employed in this county from each ward. Because I can say here, Honorable Speaker, that some wards are very disadvantaged. And it is now high the time that we need to bring balance in this county. You'll find, you cannot mention a ward because we have not managed to count it, but we need to get the exact figure. So that even when we are negotiating for our people to be employed, you are not only negotiating with mouth, you are negotiating with fact and figures. It is my plea that that motion Honorable Kongo requests that he might brought in the House, we need it. In fact, we need it, even we need sometimes to have a committee of the whole House where we can invite the county secretary, where we can invite the board, so that we can ask them whether they, if it is a matter that they cannot be able to undertake, they can even get a private group or a private team that can help them come up with the data that is needed. Otherwise, Honorable Speaker, many counties, they might fail to disclose the exact number because maybe of ghost workers. And that's why we are suffering. In fact, I believe if the calculation can be done properly, even the deficit that we see of 200 million plus, it's, in fact, you might find that money is not even there. Because if we do things the right way, we'll even get the value of what we provide. Thank you, Honorable Speaker.
Honorable Mirka, then Honorable Steve.
Honorable Speaker, I stand in support of my colleagues who have spoken earlier on the issue of staffing and getting the right data in this county. Mr. Speaker, as one of the members have said, this has been a thorn in the flesh. And I don't know what is so difficult for this county to just give data. They have data because they pay these people, they have the registers every day, they have the work schedules every day. So why is it so difficult for these people just to answer a question that has been asked by this assembly? Over several years, this has been a thorn in the flesh, Mr. Speaker. And it is the high time now we take, I think we take the next course of action. Because I was sitting with Honorable Mwangi Gishuki here, and he's telling me that Engineer Hospital cannot be a level 4 hospital because of lack of staffing. Yet I hear people saying there are workers who are out there who are, we don't know what they are doing. They are there out there. We don't know exactly what they are doing. So why we are asking for this data is just to know exactly what are these staffing gaps that we have. Do we have excess, or what is it that the county is suffering from? I am a member of Budget Committee. Mr. Speaker, the 35% requirement, we have already surpassed it. Yet, the county is telling us that there are staffing gaps. We really need to know, for us to budget, Mr. Speaker, we really need to know what are exactly those staffing gaps. And another critical question that have been asked. Every year, there are people who retire through natural attrition, through, attaining their retirement age. There are those people who resign. Do they have this data? Because surely, Mr. Speaker, we can't be suffering when there's something that we can do. The Department of HR in this county must rise to the occasion and answer the questions as we ask. And I want to support this Honorable House and the members that we need to move beyond the statement and get a motion. We are not, we are not asking for anything. We're just asking so that we can help our people. I feel pain when a hospital like Engineer Hospital that has been equipped, that is ready to get to a level 4 hospital, it can't get to a level 4 hospital because of understaffing. If this government wants us to help them, can they give us this data so that we can analyze the data critically? And then we will advise if, in any case, our advice as members and the representative of the people is needed, Mr. Speaker. Otherwise, they may not need our advice, and we are here pushing for things. But for the sake of Nyandarua, and for the sake of Wanjiko, who I represent in Kerita Ward, I need to know how many people are employed in Kerita Ward. For example, I am having a problem with the municipality as we speak. Our town is dirty, Maironya. I have requested for additional staff. I'm told there are no staff. But when we look into the record of this county government, we have more than 10 staff who are employed to do the Maironya municipality. Where are they? What are they doing? Probably these are the ones who moved to revenue collection. They are in the books that they are serving Maironya municipality. Yet, they are not serving Maironya municipality. So, Mr. Speaker, we really need to move into action, move into the details, and let us get exactly, for example, in Maironya municipality, there is a list of people employed to clean, to collect garbage there. Yes, in the books, but in the reality, where do they work? So, Mr. Speaker, I request, as a representative of the people, we move a motion that will compel this county to tell us exactly where these people are and who is working where, Mr. Speaker. If the motion is not enough, then we can summon through the committee of the whole house, we can summon the minister here so that he can explain to us why are they denying us that information. Yet we are the representatives of the people. They are doing disservice to our governor because the governor is the one who went to the ground to seek for election, and he had promises that he made to our people. These people sitting in those offices, Mr. Speaker, are doing a disservice to the governor. So, Mr. Speaker, we either summon them or do a motion. Thank you, Mr. Speaker.
Honorable Steve Matimu.
Thank you, Mr. Speaker, for granting me this opportunity. Mr. Speaker, mine will be very, very brief. And one, I'm very disappointed, Mr. Speaker, because the report that has been tabled today is almost 1 year old since the time that it was sought. And even in the report, whatever has been read this morning, the person who was reading, the chairman, education, Honorable Gadongo, has just mentioned that in the report, some 30 staff that were recruited in March 2025 had not been added to the summation that they were doing. This is a report that, Mr. Speaker, they are reading in February 2026. It's so unfortunate. And I don't know why the committee didn't see it prudent to try and ensure that they add up even what we have currently. But what has struck me, Mr. Speaker, is something that, and I really support the other members who have just spoken before me, that we have been having inconsistent number, the number that we've been given every time by the executive in terms of the staff in in terms of payroll. Mr. Speaker, I've just checked on the Auditor General report. In the year 2023-2024, the Auditor General realized that we have a staff of 2,480. In this, in the previous financial year 2024-2025, the Auditor General in his report realized that in Nyandarua County we have a staff of 2,429. Mr. Speaker, in the report that we are receiving this morning from the committee, they are talking of a staff of 2,910. where is this additional staff coming from? That when the auditor is auditing our books, doesn't come across these numbers, Mr. Speaker. It's unfortunate that the report that we've received is not capturing all these, and I will humbly request, and I tend to agree with the members who have just spoken, that the report that you've received this morning, Mr. Speaker, let's handle it as an interim report, and let's have a comprehensive report showing us in details each and every department, and maybe even including the names of these staffs. And maybe, Mr. Speaker, even ensuring that we have accurate numbers. Because like I've said, Mr. Speaker, what the Auditor General, I don't know why, Mr. Speaker, Honorable Agitau is distracting the House. I don't know why we're having a big difference between what the Auditor General audits in our accounts. Because like I've said, Mr. Speaker, the last financial year, we had 2,429. Then what we are receiving here is 2,910. Where is this imbalance coming from? I think it's our high time that we crack the whip and ensure that, Mr. Speaker, we get the actual number of staff in our county. Then, Mr. Speaker, there's this issue that we are talking of. We don't have enough staffs. Mr. Speaker, I would wish that our county, they look at each and every department, what we need in a department and what is a surplus in that department, so that if we have more human resource in a certain department, they transfer the other staff to a department that requires the same. Mr. Speaker, again, one thing that has also struck me is we have staff who have gotten out of the county government, maybe by death, by retirement, but the number never subsides. It remains the same, and even other times it goes higher. But when you ask about the manpower in some departments, you find that we don't have enough people to work. Mr. Speaker, I think even if it calls for us as an assembly visiting some of these departments, I think it's our high time to ensure that, Mr. Speaker, we get to know the actual number of staff in our county. Thank you, Mr. Speaker.
Well, Honorable Gadungu, you may need to respond to those concerns.
Thank you, Honorable Speaker. Honorable Speaker, I've heard loud and clear on the observations that members have made. And Honorable Speaker, I would say I'm in agreement. You see, this is a report as at 30th March 2025. And Honorable Speaker, we are on 17th February 2026. And Honorable Speaker, with the new County Public Service Board, I would be in agreement with what the honorable members have observed, Honorable Speaker, that we need total head count per department, Honorable Speaker, so that we can know the staffing gaps that we have. And Honorable Speaker, we can as well check on the staffing gaps. Honorable Speaker, it's quite unfortunate that, as Honorable Bai has observed, is that there are employees which previously were maybe in the Department of Environment to clean towns, and they have changed their duty stations, Honorable Speaker. And that is why we are having issues, Honorable Speaker. So as per your direction, Honorable Speaker, I would wish, despite the fact that we have made this report, it's not as comprehensive as we would like to see it in the House. I would like, with the new County Public Service Board, let us get another report on the staffing. And Honorable Speaker, it can't take long. These are things which are in the fingertips of every department. So, Honorable Speaker, that would be my observation. It's quite unfortunate that the Speaker of the statement is not in the House, but it is good for the consumption of the members who are in the House. Thank you, Honorable Speaker.
Thank you, honorable members. Next order.
Order number 8, motions and bills. And this order, there are two motions. The first one is by Honorable Paul Gesho-Mbaire, the Chairperson, Committee on Health Services.
Honorable members, you know that the motion was interrupted during the last week's sitting due to a quorum hitch when the mover was on the floor. Therefore, Honorable Geche, Chairperson, Committee on Health Services, and Member for Kipipiri may proceed.
Thank you, Mr. Speaker. Mr. Speaker, we were looking at the recommendation by the committee, and we had 19 recommendation. We touched something on NHIF capitation, and we had noted that NHIF capitation income had been reported at 33 million for the year under review. And this was an increase from 29 million reported in the year 2022, 2023. I will not belabor much, Mr. Speaker, but it is good to note that the NHIF Leader Mama program management clarified that revenue is based on reimbursement for maternity services offered. The hospital must raise support and submit claim to NHIF for payment after providing the services. We looked at the depreciation expenses. I will be making highlights because the report is ready even in our gadget. And you see, there is a provision for expenditure depreciation, the depreciation on expenses. We noted that the statement of cash flow for the year ended 30th June 2024 incorrectly reflected a depreciation expenses of 9 million. And despite the depreciation being an uncash expense, the committee therefore sought clarification on the basis of this inappropriate accounting treatment. So we have recommendation that CCM for Finance should establish a rigorous internal review process and also institute regular training and capacity building for finance and accounting staff on IPSAS, PFMA Act. And also, we had the issue on medical costs, and we noted they had decreased by around 2 million, and we wanted a clarification on factor contributing to this rise. We observed that across all expenditure categories, the recomputed total deferred significantly for the amount reported in the financial statement, raising concern about the accuracy and reliability of the disclosed figure. Mr. Speaker, when you go to employee costs, remember we have spoken about the issue of county employees, the number. You just listen to this one. The committee sought clarification on substantial increase in employee cost from 132 million to 165 million in financial year 2023-2024. In response, management explained that employee-related expenses may rise due to factors such as staff promotions, deployment of additional personnel, transfer of staff in lower job group, or posting of staff in higher job groups, among other staffing adjustment. However, the committee found this explanation inadequate as it did not address the specific factor contributing to the notable increase reported for the period under review. The committee further observed that the response provided by the medical superintendent was detached from the core issue, reflecting a lack of seriousness and an apparent disregard for the Assembly Oversight Authority. So what we recommend is that the CCM for Health Services formally direct the medical superintendent to furnish the county assembly within 14 days of approval of this report Detailed data supported breakdown explain the specific factor that led to the increase in employee cost for financial year 2023-2024. This should include staff establishment, changes, promotion, deployment, job group movements, and any other personnel adjustment affecting the wage bill. Number 2, that the CCM for Health Service issue a formal reprimand to the medical superintendent for providing an inadequate and unresponsive explanation which demonstrated disregard for the assembly oversight function. The reprimand should emphasize the obligation of senior officers to provide accurate, relevant, and respectful responses to oversight inquiries and warn against recurrence. We had issue number 12, cash and cash equivalents. The committee noted that the hospital reported cash and cash equivalent amounting to 1 million as at 30th June 2024. However, the committee was unable to confirm the accuracy of this figure because the statement of cash flow contained significant errors, including the incorrect treatment of depreciation as a cash flow outflow and the misstatement of addition to property, plant, and equipment by 13,465,117, and it was less by 1,390,578. Based on the corrected figures, the committee observed that the hospital cash and cash equivalent would have declined substantially from 3,536,238 in financial year 2022-2023 to 3,116,078 in financial year 2023-2024. In response, management explained that cash and cash equivalent may increase or decrease depending on the level of revenue generated and the extent of budget absorption during the year. However, the committee noted that this is general explanation did not adequately address the specific misstatement identifying the financial statements. So, committee recommends that the CCM for Health Services does formally direct the hospital medical superintendent to submit a corrected and fully reconciled statement of cash flow, including accurate treatment of depreciation within a specified time frame. Number 2, that the medical superintendent does provide all supporting schedules and documentation necessary to verify the reported cash and cash equivalent with failure to comply, attracting appropriate administrative action. We have the issue of count receivables, Mr. Speaker, that is 13. We also have pharmaceutical and pharmaceutical supplies. And this one, Mr. Speaker, you can allow me to, because most of the time people will tell you we don't have medicine. What happens? The committee noted that during the period under review, the hospital reported expenditure of 2 million on pharmaceutical and 3 million on non-pharmaceutical. Non-pharmaceutical are like gloves, bandages, so we spent more on those other than the farm. In addition, the hospital was reported to have reported to have received pharmaceutical and supply valued at 8,598,908 from the county government. Remember these ones, we have the facility improvement fund. They can procure on their own. And also now we have the county budget. So from the county budget, it injected 8 million. To verify the accuracy of this figure, the committee requested the hospital management to provide supporting documentation for all of pharmaceutical and pharmaceutical and other hospital supply procured or received in financial year 2020-2024. Although the management have failed schedules to support the disclosed amount, the committee review established discrepancies. The verified cost of pharmaceutical and non-pharmaceutical procured directly by the hospital was 1,867,127. Kenya shillings 2,595,788 respectively, significantly lower than the reported figures or values they are up. Furthermore, the committee could not authenticate the supplies purportedly received from the county government. The documentation contained items such as plumbing and maintenance materials that did not follow under either category. So, Mr. Speaker, it is hard even to know whether the 8 million that county had injected really bought the pharmaceutical. The committee could not, was unable to. So what we recommend is that within 14 days of the approval of this report, the medical superintendent does provide accurate, itemized and verifiable documentation for all pharmaceutical and supplies reported for the financial year 2023-2024, including proper categorization of items received from the county government. Number 2, that the county executive committee member for health does institute strict internal controls and periodic audit on the hospital inventory management and reporting system to prevent miscalculation supplies, ensure accuracy of financial disclosures, and enhance accountability in the management of pharmaceutical and pharmaceutical non-farm. So there is the issue of the status. I only left with the 2. So the status of the hospital classification as a level 4 facility. The committee sought clarification from the medical superintendent on whether the hospital was a fully fledged level 4 facility as per national health sector standard. In response, management stated that Engineer Hospital is officially classified as a level 4 sub-county hospital in line with the Kenya Health Policy 2014-2030 and the Kenya Essential Package for Health, and provided supporting registration document. Management further explained that the hospital offers a wide range of services, including inpatient and outpatient care, surgical and maternal services, laboratory radiology services, omaphology, orthopedics, and emergency services, supported by a functional governance structure comprising the hospital management board, medical superintendent, and health administrative officer. Additionally, management had highlighted ongoing infrastructure and human resource investment, such as the newborn unit, pharmacy store, accident and emergency departments, which are intended to further strengthen its level 4 status. However, the committee observed that despite the official registration, the hospital still falls significantly short of meeting several substantive requirements expected of a fully functional level 4 facility. The committee therefore noted a clear need for prioritization and targeted investment by the county executive committee to align to hospital capacity, infrastructure, staffing, service readiness with standard prescribed for a level 4 institution. The committee recommends that the county executive member for health services does request His Excellency the Governor and the CECM to consider fast-tracking the achievement of all required thresholds and milestones for the hospital to attain full level 4 status by allocating adequate budgetary resources to support the necessary physical infrastructure improvements and human resource enhancement. Issue number 18, we had incomplete financial statement, value of RAD not disclosed. What are we saying? It is that the hospital financial statement were incomplete as they failed to disclose the value of the RAD on which the facility sits. Nobody knows the value of RAD for Engineer Hospital. Despite this being a material asset required importing at applicable county standards, the committee therefore sought clarification from the medical superintendent on why the value of the RAD was omitted, and requested additional information regarding the size of the RAD, its adequacy for current and future expansion, ownership, documentation, and measure in place to safeguard it from encroachment. When we don't reveal the value of the RAD, we may, in the future, we might find some people encroached it, and nothing will happen. But the standard, the financial standard requires that this disclosure should be made annually, yearly, and that this is not that we are asking as a committee. It is what the financial standard calls for. So, in response, management stated that the value of hospital RAD had not been included because valuation by the county government value had not yet been finalized. Management further asserted that recognition of public RAD is carried out at the controlling entity level, that is the county government, in accordance with IPSAS. They indicated that the hospital currently occupies 2.83 hectares, or that is around 7 acres, and an additional 1.5 acre acquired in 2025, totaling to 8.49 acres, with the title deed for the initial parcel having been processed in 2025 after a prolonged 33-year effort. Management added that the land is adequate for ongoing and medium-term expansion project, including the accident and emergency unit, pathology laboratory, pharmacy store, and additional ones. Safeguards such as fencing, security patrols, and collaboration with the county lands department are also reported as measures to prevent encroachment. However, the committee noted that the management's assertion that the county government is the controlling entity for purposes of land was misleading and incorrect, as the hospital, being a county entity, has control over all assets within its boundary, including land. Therefore, the value of the land should have been disclosed in the hospital's financial statement, in line with the IPSAS requirement on recognition of controlled asset. Thus, committee recommend that the medical superintendent does urgently outsource a formal valuation of its lands and any other significant assets, and ensure their proper recognition and disclosure in the financial statement in compliance with IPSAS. The Chief Officer for Finance does establishes robust internal controls and oversight mechanism to prevent omission and misleading assertion in financial reporting. Finally, there is self-evaluation of the hospital opportunities and threats. The committee reviewed the hospital management's self-evaluation and noted that the analysis comprehensively identified both the key opportunities, such as land for expansion, growing population demand, and potential funding under UHC, and major threats including delayed reimbursement by SHA, rising operational costs, procurement bottleneck, and shortage of specialized staff. Mr. Speaker, you know, when we talk of specialized staff, now that this facility should assume level 4, we need some critical staff. And some of the critical staff we need is a physician. We need a cardio. We need a neurosurgeon, an anesthetist, amongst others. So we are lacking specialized staff. And when we talk of staff establishment, that is where you will realize, if we do the staff establishment, the critical staff will be able to be identified and actually be hired. The committee concurred with the management strategic assessment and acknowledged the proposed responses aimed at enhancing financial sustainability, strengthening human resource capacity, and improving service continuity. Recommendation from the committee is that the medical superintendent does develop clear timelines and escalation mechanism for following up on all pending reimbursement with the SHA, chief medical insurance companies at the county revenue fund, ensuring that delays do not continue to expose the hospital to cash flow challenges and supplier debt risk. Number 2, the county secretary does ensure that the county executive committee member does consider prioritizing the recruitment of critical specialized staff and the fast-track procurement process to ensure uninterrupted service delivery and to enable the hospital to fully leverage emerging opportunities such as expanded services and UHC funding. So, Mr. Speaker, in a nutshell, what we are saying, when we are presenting this report on the Engineer County Hospital, we as a committee, we are not pointing the mistake or errors that they are there. We only need now we improve as a county. A miracle has happened, Mr. Speaker. when we started with the JM, the scrutinizing these financial statement, we can report a positive change, even in terms of deliveries. This facility of ours were being run like a kiosk. There were no guidelines. There were no procedures. There were no protocols. And Mr. Speaker, this is made toward upgrading the hospital to a full-fledged level 4 facility and securing ownership of its land after more than 3 decades. These milestones reflect commendable commitment to the institutional growth, documentation of waivers and expenditures, delayed reimbursement from the county treasury and NHIF, now SHA, incomplete financial reconciliations, insufficient automation and audit controls. The absence of board adoption minutes, non-valuation of hospital lands and gaps in revenue disaggregation further highlights weaknesses in financial governance and compliance with the Public Finance Management Act 2012 and its attendant regulations. The committee therefore emphasizes the need for the Department of Health Services and the hospital management to strengthen accountability mechanism, enforce proper record keeping and reporting procedures, and ensure timely submission of budgets and statement for legislative oversight, addressing human resource gaps and adopting innovative cost-saving measures will also be critical to improving service delivery and financial sustainability. In conclusion, the committee reaffirms its commitment to supporting the continuous improvement of Virginia County hospital governance and performance framework with the ultimate goal of ensuring efficient, transparent, and accessible healthcare services for all the residents of Nyandarua County. So, Mr. Speaker, allow me to now call Honorable Juliana Babu to second.
Honorable Babu, Juliana Babu Mugure, proceed.
Thank you very much, Mr. Speaker. I stand this morning to second the report. Without really saying much, I want to agree word by word on what our chair has explained about the Engineer Hospital, and also inform the House that we are also currently, as the Committee on PICPAC, looking at the Auditor General report on the Engineer Hospital as well. And the same issues that the Honorable Chair has mentioned are still the same issues that are recurring in the report from the Auditor General. I also want to inform the House that we will liaise with the Chair so that we do a conclusive, as they do their report, we also do our report and do a conclusive report. Thank you, Speaker.
The motion is duly moved and seconded. I propose the question, which is that the House does adopt the report by the Committee on Health Services on Engineer County Level 4 Hospital Annual Report and Financial Statements for the year ended 30th June 2024 as a report of the House and the recommendations therein as the resolutions of the House. Honorable Mirka Wajiro, member for Kirita, proceed.
Thank you, Mr. Speaker. And I rise first to thank the committee. I think for the first time, I have seen a report that can help this country, a report that can help this county. Thank you, Chair, and your committee. I have seen your recommendations. I've seen what is it that you have written here. If it is taken seriously, it can help this county, not only Engineer Hospital, even other hospitals. And thank you, Chair, also because you mentioned, it's not about witch hunts. It's not about pointing out mistakes. We are one. The executive and assembly, we are conjoined at the hips. So what we are doing is just to give recommendation to the county government, to the Department of Health, so that they can take this recommendation seriously. Because I believe, Mr. Speaker, having such a report has costed the committee time to sit, think critically, do research, and come up with such a report that can help this county to move forward in terms of health provision in our hospitals, Mr. Speaker. But I'm a worried person, Mr. Speaker, because how many recommendations have we made in this assembly? How many motions have we moved in this assembly? Out of the many motions, out of the many recommendations, how many have been implemented? And I'll prevail upon the implementation committee. Probably they need to give us a report on the kind of, on the implementation status of the recommendations that we make in this assembly. Sometimes we sit, we burn midnight oil, Mr. Speaker, to come up with such reports. But it is unfortunate that this report will land somewhere and it will be forgotten forever. What are we saying? We need the executive now to be serious on implementing whatever is it that we are saying as a county assembly. I'm happy that Mheshimiwa Honorable Gesha has said that from the other report of the JM hospital, they have seen some improvement. That is the kind of language we want to hear, Mr. Speaker. That yes, the assembly has given us recommendation. We are implementing. They may not implement everything that we are telling them, but can they implement what is necessary? And I know whatever recommendation we give in this assembly is necessary. And if they do that with our support and with the support of development partners, we can change this county. I'm talking with a lot of passion because we sit here from morning to this time just not to do nothing. Whatever we are doing here is serious business for this country. And that is why we were elected as a representative of the people to represent them in everything that we do. Therefore, Mr. Speaker, such recommendation and such good reports should be implemented fully. So what am I saying? I am in total support of this, a report by the Committee on Health, and every recommendation from number 1 to number 18, I think so, are very important for this county. I stood here earlier and mentioned about engineer. I don't come from Kinangop, but at least I know engineer in papers is level 4, but implementation is not yet level 4. Yes, in papers we will say we have a level 4 hospital, but from even the report here, I had not even seen this report on Ambogation. There are gaps. There are things that needs to be done for engineer hospital to be a level 4 hospital. So let us not pride in papers. Let us pride in actions. And actions can only come through implementation of such good program, such good recommendations that have been made by the Health Committee. In conclusion, Mr. Speaker, can you request the Implementation Committee to give us the status of the motions that we've passed in this assembly, the recommendations that we made in this assembly, and how far is the status of implementation from from the county government. Then from there, we were able to assist our people to know whether they have been implemented or not, Mr. Speaker. And with those very many remarks, I support.
Thank you, Honorable Wajiro. I believe on the implementation committee, we can guide them with a statement on the same. Honorable Steve Matimu, proceed.
Mr. Speaker, I think Honorable Wanjiro has said it all, what I really wanted to put across. One, I really wish to really thank the committee led by their chair, Honorable Geshe, for a very conclusive report from Engineer County Hospital. And mine, Mr. Speaker, will be touching on what Honorable Wanjiro has just concluded on. Matters recommendation that we do recommend to the executive. From the report that, Mr. Speaker, we have, or from what we've just read, I've seen several areas that the committee, led by their chair, suggesting 14 days period for various issues that should be implemented. If we don't give guidelines to the committee, Mr. Speaker, we might not receive the feedback to this Honorable House. And I concur with the Honorable Wanjiro that, Mr. Speaker, we should have a report in this Honorable House showing us the various recommendations that we've made, which ones have been done and what has not been done, Mr. Speaker. From what I've seen, and I really want, from this report, Mr. Speaker, I would wish we get within the 14 days, maybe after 21 days, we get a report from the chair health of has the hospital reported back to the committee on the various issues that they've placed before this Honorable House. Because I think with those recommendations that they've done, Mr. Speaker, it will be a game changer to the facility that is giving a lot of service to our people in Engineer and its environs. And Mr. Speaker, for us to have reports that take precedence in our county, Mr. Speaker, I would wish we have recommendations that are followed to the letter. With that, I support and I call the mover.
The mover, Honorable Geche, member for Kipipiri and Chair Committee on Health Services, proceed and respond.
Thank you, Mr. Speaker. Mr. Speaker, I'm very grateful to the members for the kind words of encouragement that they are showering towards the committee. Honorable Juliana, who is also the member of the committee, has indicated to this House that she sits in the County Public Accounts Committee. And Mr. Speaker, what I'm happy of is that she has indicated that whatever the Auditor General is telling or deducing in the report, it is exactly what the committee has observed. So, Mr. Speaker, this tells you now what oversight is. You see, it is very wrong for the people of Nyandarua to be depending more on Auditor General report rather than a report that is locally made and manufactured. And if I'm not wrong, maybe that report is of the same year, or rather previous year, 2023. And you see, the reason as to why we want now to be dealing with these quarterly reports, the first quarter, second quarter, and that even annually, is now we prevent the occurrence of what could have been bad from occurring. You see, Mr. Speaker, we have that thing of post-mortem. The Committee on Health should not act as a pathologist. You see, pathologists will deal with a dead a dead body. It's dead. So you are looking at the cause. But the committee here, it is trying to cure, to bring the cure before this happens. And you see, I never wanted to equate the office of the Auditor General. He or she comes when the mess has happened. Now our committee, we want to be observing and warning before this one happens. We close that loophole, we close that gap. Honorable Milka Wanjiru, the one elected woman in this Nyandarua, I can see the passion that you are having and your contribution. I have realized that you are already internalized this. And this is the kind of the report that the Committee on Health has been bringing. And every time when we are dealing with this issue with the committee, we do it for posterity. I have observed something. While I was presenting this report, one of my electorate has just shared in my wall, in my WhatsApp, that we are following and we can see what you are telling us about it in here. You see this spirit, this is debate not only on this chamber, it is out there. And when we now do it in the right way, in the right manner, people even there realize that, oh, we have trust with this, our assembly. We are building the reputation. So this is the kind of reports that the committee, we discovered that we need to internalize. We need to get the in-depth analysis so that we can cure some of the problems that we are having. Honorable Mureithi Matimu, I love how you also play the role of amicus curiae in our committee. At one time when we said things are not happening in the right way, in the right manner, I recall you empowered me with the kind words like, you know, Mheshimiwa, we can start this and we will be somewhere. And today I can report we are somewhere because that time JM was being referred as deathbed. But today I can see even people amongst the workforce, they are getting services there. So we have changed, over time, we have changed the narrative. And I love the passion, even waiting even up to this extent. And actually, he is not even one of the members of this committee. He has his contribution to the committee has not gone unknown. At one of these days when I assume the office of the president, the 7th, I know I will award you with an honor. Maybe one of the those CBS, you will be the CBS. So, Mr. Speaker, I'm happy that you accorded us time, you accorded us room to prosecute this, and it will not end here. Out of this debate, as it has been indicated, we have several issues that we can pick and follow. So maybe, Honorable Mureithi, what I can say, there is at that point you raised that we need to follow the outcome. You see, we don't have the powers. Ours is to prosecute the matter before the House. But the Committee on Implementation, within the 14 days, they need to, it is their role now, they take over where we have left. Ours can only be in fighting this for follow-up. We can do it at a follow-up, at a committee level, but we are unable to come back here to report what they have not done. But I know I will even liaise with the chair on implementation so that we can work out a formula that now this recommendation we need to be able to follow to the letter. Mr. Speaker, from your honorable office, what maybe I request is that this report or this should be relayed as it is verbatim to these organs. And because sometimes I don't want to accuse the office of the county, the clerk, the office of the clerk, but it should be relayed to those organs, including those recommendations should be expunged and or they should be relayed to every particular office. That of CS, CCM Health, CCM Finance, it should be relayed even to His Excellency the Governor himself. Some of these things need his attention. His eyes is very important. And with that, I move.
Thank you, Honorable Chair. I now put the question, which is that this House does adopt the report of the by the Health Services Committee on Engineer County Level 4 Hospital annual report and financial services statements for the year ended 30th June 2024 as a report of the House and the recommendations therein as the resolutions of the House. May those of a similar opinion say aye.
Aye.
May those of a contrary opinion say nay. And the ayes have it. Clerk, next order.
Under the same order, there is a motion by Honorable Samuel Rumui Kayani, the Chairperson, Committee on Trade, Industrialization, Cooperatives, Development and Partnership.
Honorable Wajiro, on behalf of the Chair, Committee on Trade, Industrialization, Cooperative Development and Partnership. Proceed.
Thank you, Honorable Speaker, for granting us an opportunity. I'm standing in for our Chair, Honorable Kayane, who is attending a serious business in his ward, and he could not have left the meeting to come to the assembly, but he has given his apologies. However, Mr. Speaker, we have done the report and the motion is ready. But reading from the mood of the House is like previously we had discussed with the members, and it's like that they want to go through the report further details so that they can have a vibrant debate, because the issues there, they are pertinent issues touching every ward. So the members may need some time to go through the report. So we request for rescheduling of this motion to a later date, probably next week, so that we can allow time for the members to go through the report and create some input for the motion. So therefore, Mr. Speaker, on behalf of my Chair, Honorable Kayani, I seek leave.
Okay, the resort is granted, and the matter is referred back to the House Business Committee for rescheduling. Clerk, next order.
Mr. Speaker, the business of this sitting as appearing on the order paper has been exhausted.
Honorable members, there being no other business to transact during this sitting, I now adjourn the House to Tuesday, the 17th day of February 2026 at 2:30 p.m.